Hey everyone, Dr. Mike here. Let's break down ABG interpretation, a critical skill in healthcare. Imagine this, a patient arrives, struggling to breathe. You need to know, is it their lungs, their metabolism, or something else? ABG analysis holds the key. It tells us about the acidity, or pH, carbon dioxide, known as PaCO2 and bicarbonate, or HCO3, levels in the blood, giving us a peek into the body's respiratory and metabolic balance. Think of your blood like a finely tuned engine. Just like an engine needs the right balance of fuel and air, our bodies need the right balance of acids and bases. If this balance is off, we run into trouble acidosis or alkalosis. That's where ABG comes in. It's like checking the engine light and getting a detailed report on what's going on. But here's the thing, ABG results can look like a jumble of numbers if you don't know how to interpret them. Don't worry, we'll demystify it together. We'll go step by step using clear language and real-life examples. By the end of this, you'll be able to look at an ABG report and confidently say, aha, I see what's going on here. Let's dive into the step-by-step process of ABG interpretation. First up, we look at the pH. pH tells us about the acidity or alkalinity of the blood. A normal pH is slightly alkaline, ranging from 7.35 to 7.45. Next, we move on to PaCO2, the respiratory component. A normal PaCO2 level is between 35 to 45 mmHg. Now let's look at HCO3, or bicarbonate. A normal HCO3 level is between 22 to 26 mCal. Our bodies try to maintain a normal pH balance by compensating for any imbalances. Now that we've covered the basics of ABG interpretation, let's see how it applies in real-life clinical scenarios. Imagine a patient with severe diabetic ketoacidosis, or DKA. Their ABG might show a low pH, indicating acidosis, low HCO3, indicating metabolic acidosis, and a deep and rapid breathing pattern, indicating high PaCO2, which is respiratory compensation. This tells us that their body is trying to blow off CO2 to compensate for the metabolic acidosis. Another example is a patient having a panic attack. Their ABG might reveal a high pH, indicating alkalosis, low PaCO2 indicating respiratory alkalosis, and a normal HCO3. This suggests that they're hyperventilating, causing them to blow off too much CO2 and making their blood more alkaline. Remember, ABG interpretation is not just about memorizing numbers. It's about connecting the dots between the ABG results, the patient's history, physical exam findings, and other laboratory data. For instance, a patient with a history of COPD might have a chronically elevated PaCO2, so their baseline ABG might look different from someone without COPD. Mastering ABG interpretation takes practice and a systematic approach. Here are some tips to help you along the way. Use mnemonics. Mnemonics like Rome, respiratory opposite metabolic equal can help you remember the relationship between pH, PaCO2, and HCO3. Practice, practice, practice. The more ABG cases you review and interpret, the more comfortable you'll become. Look for online resources, textbooks, or workbooks that offer practice cases. Don't be afraid to ask for help. If you're ever unsure about an ABG interpretation, don't hesitate to ask a senior colleague or consult with a respiratory therapist. Keep learning. ABG interpretation is a dynamic field. Stay updated on the latest guidelines and research. Remember, ABG interpretation is a crucial skill that can help you make timely and accurate clinical decisions, ultimately leading to better patient care. Keep practicing, and you'll become an ABG master in no time.